Technology has evolved, of course, with time. Initially, all that we had to treat blockages in the arteries of the lower extremities were balloons, plain old balloons. It got the arteries open, many times the wounds healed, and we were able to delay or prevent an amputation. Yeah. Okay. Now we have evolved to having drug-coated balloons, which have a coating that maintain the artery open. With plain old balloons, there's about a 30 or 40% chance that that blockage will come back in 3 to 6 months, and the patients would need a second procedure. With drug-coated balloons, okay, the arteries tend to remain open approximately 90% at 1 year and over 80 to 85% at 2 years, depending on the length of the original artery, whether it was a total occlusion or not. So it's much, much, much more advantageous to use drug-coated balloons now in the arteries and the legs. Yeah, at least for a year or two, which is a tremendous gain. And who knows what technology will have evolved into at that moment in time. It was originally, the drug that's used was used for cancer and to prevent growth of certain tumors. It's paclitaxel. Okay. And the coating, it's a very sophisticated process on how the coating is placed on the balloon and how it's released and the timing of the release. And that's been studied very, very well.
And just like that, Dr. Rudy Sotolongo becomes one of the area's few physicians to use drug-eluted balloons in his outpatient lab here in Southeast Texas. He wants to make this first procedure your last procedure. Just one way that Dr. Rudy Sotolongo improves your quality of life. These are professionals at Southeast Texas Cardiology Associates, Vascular Center, and Vein Clinic across from St.
Nice, black solid line through here.
Well, I've been an invasive interventional cardiovascular physician since 1980. So imagine that. I've been very blessed and fortunate. I attended some of the first meetings in the world on various techniques. I remember I had a friend of mine, a colleague next to me, and I touched him with my elbow and I said, "Look, watch this. That you're seeing history in the making." Because it's that extraordinary.
And it did. It changed.
It revolutionized cardiovascular medicine completely. Well, to give you an example, okay, once we were able to utilize balloons, the mortality, the death rate of heart attacks dramatically dropped. Because, for instance, in a straightforward, uncomplicated heart attack, okay, from the minute they go to a heart cath lab hospital with an experienced operator, okay, and the blockage is crossed with a wire, a stent is deployed, the heart attack is aborted, period, and the damage is limited. So if it takes 6 hours for a full thickness layer of heart muscle to die, and the patient arrived and the procedure and everything was done within an hour, 90 minutes, let's say an hour and a half, they just have an innermost layer damaged, little scar, and they're out of the hospital the second day. So it's a dramatic. Now, in the arteries of the legs, it's what we're after is primarily limb salvage. What I like to specialize in is saving limbs. And oftentimes I'll see patients on second requests of second opinions who are scheduled for amputations, and that's the last thing we want to see. Okay, so saving a limb with a drug-covered balloon and knowing that you're going to have a 90% patency if you're successful, but more importantly, preventing that amputation is what our number one goal is. Let me give you an example. It's very fulfilling, but there's also something very interesting about it, okay? If you go in and take care of a heart attack, as I have hundreds of times, and you save somebody with an elephant on their chest, that are pale, that are sweaty, that are vomiting, that their top blood pressure is 70 or 80, when they're discharged from the hospital, they thanks doc, you saved my life. Thank you, doc. When they see you in the clinic, doc, you saved my life, and everything's beautiful, and it's a great, very rewarding feeling. However, when a patient has been put on the schedule to have an amputation, and you spend some time and you are able to open a blood vessel and save the limb, and the ulcers and the gangrene heals, okay? When you see them in the office, they're walking in, they grab you by the neck and start hugging on you, telling me, "Doc, you saved my leg, you're my hero."